Hi, everyone. Welcome to today's webcast from the Agency for Healthcare Research and Quality about understanding SOPS surveys, a primer for new users of AHRQ surveys on patient safety culture. My name is Sari Edelman. I'm a lead research associate at WestStat for the contract that supports AHRQ SOPS surveys, and I'll be the moderator for today's webcast. Next slide, please. So before we begin, I just have a few standard housekeeping details. First, if you are having any issues with sound coming from your computer audio, you can connect to the meeting audio using your phone by clicking on phone call to find the dial-in number and meeting ID, or call me to enter your phone number and receive a call back from Zoom. If your computer freezes during the presentations, you can try logging out and logging back in, but you may just be experiencing a lag due to your internet connection speed. And if you need technical assistance at any time, use the Q&A icon that I'll show you on the next slide. At any point in today's meeting, you may ask a question through the Q&A feature shown here. Look for the Q&A icon next to the raised hand tab. We encourage you to share your name and/or organization or role when you type your question. Speakers will respond to your questions during the Q&A portion of today's webinar. And to minimize distractions throughout today's meeting, participants are muted and cannot show video. In addition, the raise hand feature and chat are also disabled. And as a reminder, today's session is being recorded and a replay of today's webcast will be made available on the AHRQ SOPS website. So now I'm happy to introduce our speakers for today's webcast. We're very pleased to welcome Sylvia Fisher, who is a senior social science analyst and serves on the Consumer Assessment of Healthcare Providers and Systems, CAPS, and SOPS teams at the Agency for Healthcare Research and Quality. I'm also pleased to introduce my colleague, Laura Gray, who is the SOPS project manager and a WestStat senior study director. And finally, I'm happy to introduce my colleague, Ryan Hare, who manages the SOPS databases and is also a WestStat research associate. And as I said, I'm Sari Edelman, and I'll be your moderator for today's webcast. Next slide, please. So here is our agenda for today's call. We'll start with Dr. Sylvia Fisher giving a brief overview of the AHRQ SOPS program. Then Laura Gray will provide an overview of the SOPS surveys, and Ryan Hare will provide information on the SOPS databases and SOPS resources. We'll end with questions and answers with a question and answer session at the end. So we can begin, and I'll hand it off to Sylvia.
Thank you, Sari. Good afternoon, everyone, and welcome to this presentation today on understanding the AHRQ surveys on patient safety culture, or SOPS program. The SOPS program hosts an annual SOPS 101 webcast to introduce new users to the program goals, surveys and what they measure, and how to use them. We also include any recent or planned updates or activities on these webcasts. So even if you are not new to the SOPS program, you will receive some new information. You can find more information on everything we discussed today on our website. In addition, please consider contacting our technical assistance service for any questions you may have. We will tell you how to access the website and technical assistance at the end of today's presentation. Next slide, please. I would like to tell you a little about the Agency for Healthcare Research and Quality so you can see how the SOPS program fits within the agency activities. AHRQ is a research-based agency of the U.S. Department of Health and Human Services and supports evidence-based practices. We are the lead federal agency charged with improving the safety and quality of America's healthcare system. AHRQ is a research agency, not a regulatory agency. As a research agency, AHRQ does not have the authority to require the use of our tools and surveys or to have survey results submitted to us. If there are requirements or options to use the SOPS surveys as part of a program, those requirements come from another organization or agency. Next, please. At AHRQ, we talk about our core competencies: health systems research, practice improvement, and data and analytics. AHRQ's mission is to improve the life of patients by helping healthcare systems and professionals deliver care that is of high quality, high value, and safe. AHRQ is a science-based agency. Accordingly, we invest in research and evidence to make health safer, and improve quality. We create tools for healthcare professionals to improve care for their patients. We also generate measures and data that are used by providers and policymakers to improve performance and evaluate progress of the U.S. healthcare system. We believe that it is important to push science to implementation and distribute our tools and products to users. Next, please. AHRQ's patient safety program's priorities are to focus on areas of greatest impact, extend patient safety improvement to all settings, prevent healthcare-associated infections or HAIs, and reduce antibiotic resistance, build capacity in the healthcare system to accelerate safety improvements, improve communication and engagement between clinicians and patients, and make the safe thing the easy thing to do. Next, please. AHRQ SOPS program began in 2001. The SOPS program develops validated surveys to measure patient safety culture in facilities using best methods for development and testing. In addition to the surveys, the SOPS program also conducts research to further our understanding of patient safety culture and tools to improve patient safety culture. The SOPS surveys are trademarked, which ensures that they are valid and reliable and have met certain criteria in their development and testing. Next, please. I would like to review AHRQ's definition of patient safety culture. Patient safety culture can be defined as the beliefs, values, and norms that are shared by healthcare providers and staff in an organization. Patient safety culture determines behaviors that are rewarded, supported, expected, and accepted within an organization as they relate to patient safety. It is also important to note that culture exists at multiple levels, from the unit level to the department, organization, and system levels. Next, please. Here's an overview of database activities for 2023 for SOPS. The SOPS Ambulatory Surgery Center database submission period will be June 2023, and the SOPS Medical Office database submission period will be September 2023. Also for release in 2023 will be the Nursing Home Database Report and pilot study results for the Nursing Home Workplace Safety Supplemental Item Set. And now I'd like to turn this over to Laura Gray, who will provide an overview of the SOPS surveys. Thank you, Laura.
Hi, thanks so much, Sylvia. As Sylvia mentioned, I'll now provide an overview of the SOPS surveys. Next slide, please. Okay, so what are the SOPS surveys? They are surveys of providers and staff that assess the extent to which their organizational culture supports patient safety. As Sylvia noted, the SOPS program began in 2001 with the development of the hospital survey on patient safety culture, which was then released in 2004. And there are now 4 more SOPS surveys for the following settings: nursing home, medical office, community pharmacy, and ambulatory surgery center. And we refer to these as core SOPS surveys. Next slide, please. So here are 5 reasons to use the AHRQ SOPS surveys. First, the surveys were developed with extensive input from healthcare professionals and experts to make sure that they ask about the most important aspects of patient safety culture. Secondly, the surveys were comprehensively tested so that they reliably assess clinician and staff perceptions in your organization. Third, the surveys AHRQ SOPS databases contain survey data that are voluntarily submitted by hundreds of healthcare organizations so that you can compare your survey results to others. And fourth, the SOPS surveys are actionable, meaning that you can use your results to identify strengths and areas for improvement. And fifth here, AHRQ provides free technical assistance and resources available. And we'll be talking a little bit more about these points throughout today's presentation. Next slide, please. So this slide here shows some of the areas of patient safety culture that are assessed across each of the SOPS surveys. although the survey items are tailored to be specific to each setting. The areas of patient safety culture, or the composite measures that are assessed across the surveys, include communication about error, communication openness, organizational learning, continuous improvement, overall rating on patient safety, response to error, staffing, supervisor and management support for patient safety, teamwork, and work pressure and pace. Each of the SOPS surveys also assess patient safety culture areas that are unique. Next slide, please. So all SOPS surveys are composed of standardized questions. These are core items that support the comparability of survey content across users. To assess additional content areas not included in the core survey, you can add optional supplemental item sets. The cover pages for the supplemental item sets provide instructions about where to place the items toward the end of the SOPS core survey. Next slide, please. So supplemental items assess additional areas of culture beyond those in the core SOPS surveys. Again, these are optional and they can be submitted to the databases along with your data from the core SOPS survey. The supplemental item sets focus on the topic areas of health information technology, or health IT, workplace safety, value and efficiency, and diagnostic safety. And they've been tested for use in the settings indicated on this table. So that is health IT, workplace safety, and value and efficiency for use in hospitals, with value and efficiency and diagnostic safety in medical offices. As noted here, we are also currently developing a supplemental item set for workplace safety nursing homes. Next slide, please. So I'm going to tell you briefly about each of these item sets. So released in 2018, the SOPS Health IT Patient Safety Supplemental Item Set is for hospitals and focuses on how the use of health IT affects patient safety. And this item set focuses on EHR system training, support and communication, workflow work processes, and an overall EHR system rating. Next slide, please. In response to IHI's National Action Plan to advance patient safety and increased concern about the safety of healthcare workers during the COVID-19 pandemic, we developed the Workplace Safety Supplemental Item Set for hospitals. This item set was released in November 2021, and it focuses on workplace safety for providers and staff, which includes protection from workplace hazards, moving, transferring, and lifting patients, workplace aggression, and work stress burnout. As mentioned a moment ago, we are currently finalizing development on a workplace safety supplemental item set for use in nursing homes, and we adapted the hospital one for use in nursing homes and recently completed a pilot test. We anticipate releasing this item set in early 2023 and look forward to sharing more information. Next slide, please. In 2017, AHRQ released supplemental item sets assessing value and efficiency to help hospitals and medical offices assess the extent to which their organization places a priority on and adopts practices to promote efficiency, waste reduction, patient-centeredness, and high-quality care. Next slide, please. And then released in April 2021, the SOPS Diagnostic Safety Supplemental Item Set is designed for use in medical offices, and this focuses on the diagnostic process, accurate diagnoses, and communication around diagnoses. Next slide, please. All right, so this is the survey development process for all of the SOPS surveys and supplemental item sets. Let me walk you through it. First, we conduct a review of the literature on patient safety, safety culture, medical error, and event reporting, and we gather existing surveys. We identify and convene a technical expert panel, or TEP, with members representing various settings of care. We interview experts, patient safety experts, healthcare providers, and staff. Using all of this information, we then identify key areas of patient safety culture that the survey should assess, and then develop draft survey items. We cognitively test the draft survey items with healthcare providers and staff to determine how well they understood and could respond to these questions. We iteratively revise and cognitively test the draft survey items. We again obtain input from the technical expert panel, and then we pilot test the draft survey in the healthcare setting. We conduct psychometric analysis of the pilot test results to examine the reliability and the construct validity of the survey measures. And as a last step, we consult with the TEP to finalize the survey. Next slide, please. So now that I've told you a little bit about what SOPS surveys are available, I'd like to talk to you about how they're used. So healthcare organizations can use the SOPS surveys to assess the current status of patient safety culture, raise staff awareness about patient safety, identify strengths and opportunities for improvement, examine trends in patient safety culture change over time, and evaluate the cultural impact of patient safety initiatives and interventions. Next slide, please. So there have been a number of analytic studies linking SOPS survey data to other outcomes. And I'd like to share a few of those with you here. Higher SOPS hospital scores have been linked to lower rates of surgical site infections after colon surgery, lower readmission rates, better financial performance operating margin if they had an EHR, lower adverse events, higher hospital CAHPS patient experience scores, and higher Consumer Reports hospital safety scores. Next slide, please. Additionally, research studies have found higher SOPS nursing home scores have been linked to lower turnover rates, lower use of physical restraints, fewer falls, and higher CMS 5-star quality ratings. Next slide, please. The SOPS surveys and supplemental item sets can be found on the AHRQ SOPS website at www.ahrq.gov/SOPS. The survey forms are available in English and Spanish and in PDF and in Word. For each survey, we also have a survey items and composite measures document that groups the survey items according to the safety culture composite measure that they are intended to assess. If you're new to SOPS, welcome. A great starting point that we recommend is reading the survey user's guide. Again, this is available for each survey setting, and it provides step-by-step information on how to select a sample, administer the survey via paper or web for high response rates, prepare and analyze your survey data, and produce reports of your results. And now I'm going to turn it over to my colleague, Ryan, to tell you about SOPS databases.
Thanks so much, Laura, and good afternoon, everyone. Thank you for joining us today. Next slide, please. AHRQ supports SOPS databases for each of the 5 SOPS surveys. The databases intake data from facilities that have administered one of the SOPS surveys and voluntarily submit their SOPS survey data. The most recent SOPS database reports include data from 400 hospitals, 1,100 medical offices, 191 nursing homes, 331 community pharmacies, and 235 ambulatory surgery centers, or ASCs. The newest database in terms of when it was established is the SOPS ASC database, and a new nursing home database report for 2023 will be coming soon in the spring. Next slide, please. So why should your facility participate in the SOPS databases? First, facilities that submit to the database are part of the results in a database report with de-identified aggregated statistics. Second, participating organizations receive a feedback report for each facility that submitted data. The feedback reports compare their results to the database results and can help to identify strength as well as areas for potential patient safety culture improvement. Next slide, please. AHRQ supports 2 databases per year, and in 2023, we will have 2 SOPS databases open for users to submit their survey data. The first is the SOPS Ambulatory Surgery Center database, which will be open for submission from June 1st to 22nd. Then from September 1st to the 22nd, the SOPS Medical Office database will be open for submission. We'll also accept SOPS supplemental item set data that were administered along with the medical office survey. And you can submit survey data from the diagnostic safety supplemental item set, as well as the value and efficiency supplemental item set for medical office. Next slide, please. If you're thinking about participating in the SOPS databases, there are a few requirements for participation that you should be aware of. The first, your organization must have administered the SOPS surveys and the SOPS supplemental item sets, if you did use them, in its entirety without modifications or deletions. This is important because it ensures comparability across healthcare facilities when submitting to the SOPS databases. Second, the facilities must be located in the United States or United States territories. Third, you must sign and submit a data use agreement, also known as a DUA. The DUA indicates how the data will be used and protects the confidentiality of your organization and its data. Fourth, kind of obviously, you must complete data collection and submit to the database before the end of the data submission period. Fifth, your data must be submitted per the data file specifications. And related to that, if you're submitting data for multiple facilities that are all part of the same health system, each facility must be identified in your data file. This is necessary because we conduct analysis at the facility level and then average the results across the participating facilities. Lastly, you'll need to upload your survey data through our secure online data submission system. And we provide extensive support for the SOPS databases submission. And I'll share that help desk information with you towards the end of this presentation. Next slide, please. For each SOPS database, we create a user database report. Each report is publicly available on the AHRQ website and presents de-identified aggregated results from sites that administered the survey and submitted their survey data. The reports consist of a narrative description of the findings and breaks down the results by various facility and respondent characteristics, such as geographic region and staff position, just to name a few. This past year, findings from the 2022 SOPS medical office database were made available, as well as updated results from the SOPS diagnostic safety supplemental item set for medical offices. We also recently, just a couple weeks ago, published results from the 2022 SOPS hospital database. So I definitely recommend going to check those out. Next slide, please. Each SOPS database report also contains a database report overview infographic, which provides some high-level information and findings from the database. The infographic is also posted separately on the AHRQ SOPS website. Next slide, please. Results in the database reports are calculated as average % positive scores. And to calculate that, first we calculate the percentage of respondents at the facility level who answered positively to the questions. So looking here at this example for the survey item, in this unit, we work together as an effective team. The % positive results are those that answered either agree or strongly agree to this question. Next slide, please. The database reports present average % positive response scores for each composite measure and survey item. A composite measure is a group of 2 to 5 related items that are intended to measure a specific patient safety culture area. Here is an example of the highest scoring composite measure results from the 2022 SOPS Hospital 2.0 database report. Next slide, please. In addition to the database report, one of the major benefits of submitting to the SOPS database is getting a customized feedback report. The feedback reports show your facility's results compared to the de-identified aggregated database results. In this example, here you can see how your facility results are presented side by side with the overall database results. These feedback reports can easily be shared within your organization, and we recommend that you share the results across your organization so that everyone from leadership to department managers and frontline staff all understand their areas of strength and the opportunities for improvement within the organization. Next slide, please. AHRQ has also established a process whereby researchers can request de-identified and hospital identifiable data files from the AHRQ SOPS databases. The data sets are for research purposes only. Researchers interested in obtaining de-identified SOPS survey data from the SOPS database must submit a research request for de-identified data and also sign a data release agreement. For the SOPS hospital database only, hospital identifiable data files may be available. Identifiable data allows for the linking of SOPS data to other data sets. WESTAT reviews all research requests, and then AHRQ provides approval. Database hospitals must also agree to the request via their SOPS data use agreement or provide WESTAT with written authorization. Next slide, please. All right, so next we're going to talk about some SOPS resources. Next slide, please. With the exception of one resource, that being the SOPS Excel tool, which we'll look at here, all of the other SOPS resources can be found on the AHRQ SOPS website at www.ahrq.gov/SOPS. Next slide, please. So after you've administered your SOPS surveys, we have data entry and analysis tools that use Microsoft Excel to assist with entering survey data to create tables and graphs of your survey results. You can also use this tool to export your survey data for submission to the SOPS databases. There's a tool for each of the SOPS survey settings as well as the supplemental item set. These tools are very easy to use, and users can hand enter their data or copy and paste values from their web survey output into the data entry sheet and then see their results. To use the tool, you must have Excel macros enabled on your computer. As I mentioned, these Excel tools are the only resource that is not physically available for download on the AHRQ website. However, you can request a copy by contacting our database technical assistance help desk, which again, I will provide that contact information here in just a minute. Next slide, please. This here is an example of one of the graphs that are generated in the Excel tool. This is a look at the results for the items that make up the supervisor, manager, or clinical leader support for patient safety composite measure. So for the 3 items that make up that composite measure, that's items B, 1, 2, and 3. The tool provides the % positive, neutral, and negative response. The tool also provides the percentage of respondents that did not answer the question or selected the does not apply or don't know response option. Next slide, please. After you've administered the survey and analyzed your results, you can then use our action planning tool to assist you in developing an action plan based on your results to improve patient safety culture in your organization. The action planning tool is designed for all survey settings and provides step-by-step guidance to help survey users develop an action plan to improve patient safety culture. This tool includes an action plan template your organization can use to identify your patient safety culture areas for improvement, document goals and initiatives, any needed resources, processes, and outcome measures, as well as timelines. Next slide, please. As you're working on your action plan and identifying areas for improvement, you might also find our Improving Patient Safety resource list useful. We have resources for each survey setting and supplemental item set. These documents contain links to practical resources that are free and publicly available to help improve patient safety culture and patient safety in your organization. The resource list that you see here on this slide is the SOPS Diagnostic Safety Supplemental Item Set resource list. Next slide, please. There is also a SOPS bibliography located on the AHRQ SOPS website. The purpose of this bibliography is to provide citations for articles published on the AHRQ Safety Culture Surveys and supplemental item sets. It includes references on the use of the surveys, psychometric analysis, how to improve patient safety culture, analysis linking survey data to outcome data, analysis linking composite measures with site and/or respondent characteristics, reviews of instruments or studies, as well as international studies. Next slide, please. AHRQ also routinely sponsors webcasts, such as this one, to provide information about SOPS products and related resources, provide updates on the status of products in development, and to provide support in using the SOPS surveys and data. Our most recent webcast, SOPS Nursing Home Survey, What You Need to Know, focused on the use of the SOPS Nursing Home Survey to assess and improve resident safety culture. Speakers described the importance of resident safety culture, the survey and its administration, and the benefits of participating in AHRQ's SOPS Nursing Home Survey database. Looking ahead to early 2023, there will be a webcast on the upcoming workplace safety supplemental item set for nursing homes. We're pretty excited about that one. Next slide, please. So as I mentioned, we offer free technical assistance, or TA, to SOPS survey users. We've got sort of two avenues for that. Our general TA help desk can be reached at 1-888-324-9749 or via email at safetyculturesurveys@westat.com. Now, the general TA can help you with questions about survey administration, such as making sure that your SOPS survey aligns with the SOPS trademark and connecting you with any of the survey materials or supporting resources. International users can also contact the general TA to request permission to use any of the SOPS surveys in their respective countries. Our other TA avenue is database technical assistance help desk, which can be reached at 1-888-324-9790 or via email at databases-on-safety-culture@westat.com. The database TA can assist with all aspects of submitting your survey data to the various SOPS databases, can also send you the SOPS data entry and analysis tools and assist with using those tools, answer any questions about database reports, and respond to special analytic requests from data included in the SOPS databases. We're happy to help you on all things SOPS, so please don't hesitate to reach out to us. Lastly, we periodically, next slide, please. We periodically send email announcements through the SOPS email updates, notifying users about various SOPS happenings, such as webcasts, data submission timelines, and survey development activities. To sign up for these email updates, and go to the top right corner of the AHRQ website and click the link for email updates, and then choose the email updates associated with the surveys on patient safety culture. And you can see kind of a screen grab of what that looks like here. So that's it for the SOPS databases and SOPS resources. Now I think we're getting into the question and answer segment. Thank you.
Great. Thanks so much, Sylvia, Laura, and Ryan for your informative presentations. You've shared a lot of really helpful information about the SOPS surveys. So as a reminder, you may ask a question through the Q&A feature shown here. Look for the Q&A icon next to the raise hand tab, and we encourage you to share your name and/or organization or role when you type your question. And if you join late, a replay of today's webcast will be made available on the AHRQ SOPS website. So it looks like we do have some questions. The first one we have is for Laura. Is the SOPS just for hospitals, or can it be used to health centers?
Thanks, Sari. Thinking about a health center, I think of that as like an outpatient office for the setting of care. And in that instance, we would recommend the medical office survey on patient safety culture, as that would be the one to use. There are separate SOPS surveys for each of the following settings. We have hospital, medical office, nursing home, community pharmacy, and ambulatory surgery center. So in this instance, like a healthcare center, thinking of it as like an outpatient medical office or that kind of setting of care, we would recommend using the medical office survey on patient safety culture.
Great, thank you. We've got a few questions for you, Ryan. First one is, how is a data use agreement obtained?
So if you go to the AHRQ website, for each of the surveys, there's a dedicated page for the database. And then on each of those pages is a page with submission information. And on that page, you can find the data use agreement for download. And then you would download it, fill it out, and then when it comes time to submit to the database, send that back to us either via email, or you can upload it directly to the submission website. So there you go.
Thanks. Couple more questions for you, Ryan. Regarding database requirements for participation, do the demographic questions need to be unaltered as well?
No, you can modify those demographic questions. The caveat to that being that if you do change them, you would need to either map or crosswalk them back to the original survey options when submitting to the database. And in the instance where you might not be able to do that, we ask that you don't submit that data.
Great. Also for you, Ryan, will the medical office SOPS database include community health centers?
I assume so. I don't see why not.
Okay. Thank you.
Yeah, so I can just chime in here. So the community health centers, if they administer the medical office survey on patient safety culture, then they could submit their data to the next data submission for medical office. And that was shared on an earlier slide. It's September 2023. Oh, I'm sorry, maybe that wasn't on the slide, but that is the next planned submission for that one. So there we go.
Okay. Thanks, Laura and Ryan. Laura, a question for you. Why are there some non-composite measures? Put another way, why aren't all the measures considered composite measures?
Okay, let me see if I understand this one. So composite measures would be parts of the survey that have like 2 or more survey items, and they're demonstrated to measure the same area of patient safety culture. So like communication openness, for example, is a composite measure. And sometimes we want to assess the aspect of patient safety culture with just a single question, like a single item measure. And so we wouldn't necessarily need an entire composite measure to get at that aspect. One example of a single item measure would be patient safety grade. So that's a question that's asked as just a single question, and it's not like a composite measure that has 2 or 3 items to assess that aspect.
Great. Ryan, when will the hospital window be open for submission next?
We just had hospital submission this past year. So typically we do it in alternating years, like every other year. So a couple of years from now, I would think.
Great. Laura, can you share a pre-made Microsoft form of the survey?
So all of the surveys on patient safety culture are available for download from the AHRQ SOPS website in 2 formats. We have them posted as a PDF and as a Word file. So again, if you navigate to www.arc.gov/SOPS, and then you can pick on the left nav which survey you want to go to, which of the survey settings that we've discussed today. And then you should be able to find the Word and the PDF of those. If at any time you have any difficulty finding anything, you can always email us on technical assistance, and we have to attach it or provide you a direct URL to make sure you're getting what you need.
Perfect. Thanks, Laura. Question for you, Ryan. Are survey results public?
No, they are not public. So the individual survey results are confidential, but the SOPS database reports are publicly available. However, the results are presented in aggregate so that no participating facilities results can be identified. It's all just kind of lumped together, if you will. So there's no way to identify a single hospital.
Perfect. And Ryan, who all in a hospital should participate in the SOPS survey?
So all providers and staff can participate. We recommend that you do like a census of your staff to include like all providers and staff. You don't necessarily have to do that, but that's what we recommend.
Also for you, Ryan, is there any web survey available for use?
So AHRQ does not currently have a web survey available for any of the SOPS surveys. But if you did want to program a web survey, you could do that yourself or hire a survey vendor. For guidance on how to administer a web survey, you could see whatever survey version it is that you're interested in programming into a web survey. You could check out the user's guide for that survey. We do have some information in there.
Thanks, Ryan.
Mm-hmm.
Laura, can we administer the supplemental item sets as standalone surveys?
Thanks, that's a really good question. So the supplemental item sets were developed to be added to the SOPS survey to assess additional areas that were not covered by the core surveys. These items were tested and validated when they were administered after the core survey. So AHRQ recommends that the item sets be added at the end of each of the relevant SOPS core surveys that they've been designed for and tested with. And that's adding them after the core survey, just before the background questions. So that's where they would belong, and we would recommend administering them together.
Great. Ryan, just to clarify, we have several clinic locations. If I wanted to gather data and submit, when is the next submission date for clinics?
That is September 2023 is the next submission for the medical office SOPS database.
Okay, Laura, how do we transition from using HSOPS 1.0 to HSOPS 2.0?
Thanks. That's a really great question too. The 2.0 version was released a couple of years ago, and we have a document on the AHRQ SOPS website under the hospital survey page that provides guidance about doing this transition from the 1.0 survey version to the 2.0 version. So that document's available on the AHRQ website. And again, www.arc.gov/SOPS. And then you would navigate to surveys and hospital to find resources for helping you with that transition. Just a plug for RTA. If you have any questions at all, don't hesitate to reach out to us.
Great. Okay, we got a question, another one for Ryan. How often is the SOPS for hospitals administered? Is next year 2023 skipped?
So you can administer the SOPS hospital survey at any time, but the database submission is every 2 years. So we just had a submission this year, so it'd be 2 years from now.
Great. Laura, can the SOPS tool be used to assess patient satisfaction or patient experience?
Thank you for that question. So no, the SOPS surveys are to assess patient safety culture from the perspectives of staff and providers. However, AHRQ does have another tool, which is the CAPS surveys, and the CAPS surveys are designed to assess patient experience. And so you can also find those on the AHRQ website if you search CAPS, CAHPS.
Perfect. Okay, Ryan, do I understand correctly that the most current data for ASCs is from 2021, and then following surveying in 2023, there will be those results available?
Yes, so the latest ambulatory surgery center database report is dated 2021, and the next ASC database report will be based on data submitted this coming June 2023. But that survey data may have been collected in 2022 or even in 2023, but they'll be submitting it in 2023.
Great. So it looks like we don't have any incoming questions right now. As a reminder, you can ask a question through the Q&A feature, the Q&A icon next to the raise hand tab. Give it another moment or so. All right, looks like we're getting one more. Laura, how often should we administer the surveys to our staff? Yearly, monthly, etc.?
That's a good question. So the time to administer the survey may vary depending on your organization, but you want to keep in mind that the point of the survey, one of the reasons to administer the AHRQ surveys on patient safety culture is to assess that in your organization, and then evaluate those results and implement an initiative or try to work on an improvement effort based on your scores. So you want to kind of think of the timing to do that. One of the resources that Ryan mentioned was the action planning tool. So after you've administered the survey, you've reviewed your results, you might decide to administer some kind of action to try to address maybe an area that you were lower performing. So all of that's going to take time. So you certainly couldn't do it monthly. And so maybe it's every other year, or however the timing might work with your organization, so that you have time to administer the survey, look at the results, maybe make some changes, and then reassess the culture there. So it certainly wouldn't be too frequent. You want to make sure you have time to review the results and share them back with your staff, and then continue working on your efforts.
Thanks so much, Lauren. Thanks everyone for your great questions. Looks like we have one more question. Ryan, is the medical office survey every year? Meaning, can we submit to AHRQ annually?
So facilities can administer the SOPS survey at any time. But again, the SOPS medical office database only accepts data every 2 years, similar to the hospital SOPS database. It's you can administer at any time, but we only have the data submission to the database every couple of years.
Thanks, Ryan. We'll give it another moment for folks to ask any questions in the Q&A box. All right, Laura, can you elaborate on any tools available to improve culture of safety for organizations that already have a specific culture of safety survey in place?
Sure.
You want to repeat it?
No, I think I got it. So tools available to improve patient safety culture. So we do have a part of the AHRQ SOPS website with additional resources, and posted there are these improvement resource lists. I think Brian has a screenshot of one of them in his slides earlier, and these resource lists are designed for use after you've administered the safety culture survey and looked at your results and determined, if there's a particular area that you want to focus on for improvement. And then in this document, you can navigate to that particular composite measure or area. So for example, if staffing, work pressure, and pace was, an area that you saw as an opportunity for improvement in your organization, you can navigate to that part of the resource list and find publicly available resources that a brief description of them and a hyperlink to learn more about them. So it's just a collection of some resources that you can check out. And then also, when you're thinking about tools to improve your patient safety culture, again, another plug for that action planning tool. So this is posted on the AHRQ SOPS website, and it's a tool that will help walk you through the process of looking at your results and determining the steps to take to make an action plan for improvement. So this is identifying resources, barriers, all of the things to make sure that you can successfully implement an initiative in support of patient safety culture improvement.
Thanks, Laura. Looks like we have another one for you. What percentage needs to be complete for results to be valid?
Okay, so it sounds like this question might be about response rates and the percent to complete. So the higher the response rates, that would mean that the more representative that your survey results will be. There's not a hard cutoff for what a response rate would be to be considered valid, but we do advise organizations to get the higher response rate, the highest response rate possible, because then it means that you're representative of all of the providers and staff in your organization. So 50% or higher would be great to get on the surveys.
Thanks, Laura. So it doesn't look like we have any additional questions at this time. Thanks again for all of these wonderful questions. Just check, give it one more moment. All right, and then if we didn't get to any of your questions, please email them to the TA inbox and we'll get back to you. Thanks again for these great questions. So I think if there's nothing else, we can wrap it up on the next slide. Thank you so much for participating in today's webinar. A brief webcast evaluation will pop up when you close out of today's webcast. So please take a moment to provide us with your feedback, as it helps us improve our offerings and plan future events that meet your needs. And we do invite you to visit the AHRQ SOPS website and contact us at any time by email or phone. So thanks again for joining us. This concludes today's presentation.